theoretically live here. Okay. All right. Look, here's our
Yes.
Max did she really did an exceptional job on the graphic this time. Normally we don't give them enough information to actually include our guests, so I'm feeling good about this one. But welcome Leslie, our guest co-host, back for her second round here, and
I know.
Melissa, who's our boss. Oh my gosh, are you so excited? So we actually, you guys are not going to have Lisa at all. She's like at one of those places, with
Yeah, where
wellness
is
involved.
she? Oh,
It's
like
it's like a
she has to
weird.
lock up her phone before she got there, type of thing. Like before
Yeah,
she
she
walked
she
in.
doesn't have her phone, which as you guys know has been really hard for me because Lisa is my only source of information. So I've had to rely on other people and like read my own news. Yeah, it's like not been the best, but yeah, I'm not going to tell you guys where she's at because I think she's going to tell you guys next week. So it's very exciting. Looking forward to seeing how it feels to come back with or have no technology for a week. So yay. Also in other news this week, we have a real news show, but Melissa's car exploded and she wants us to publicly announce that she is suing Jeep. So, and legitimately, it did in fact explode.
I
Here's
can't
Melissa's
believe
car on
this
fire.
photo. I can't
So yeah,
believe
it's
this.
like
This photo stresses me out.
I mean, that's not even the bad one. The bad one is when they threw the chemical agent on the floor, the second fire, because it set fire twice.
It set fire at a gas station. Can we just stop for a quick second and talk
that's
about
what I'm
that?
talking about. Yeah.
Like, were you not afraid? Was not everyone not afraid the whole thing was going to blow up?
I mean, I was terrified.
I've seen a lot of action movies. So
yeah, no, so it's not like that. Like, you see all of that, but it's not like that. The tires blow like that, but the actual engine stays somewhat small in the explosion.
Contained fire draft.
Yeah, it's like
contained backdraft.
But then they couldn't put out the fire, and then when they finally did, the fire department did not lay down the chemical agent to absorb the gasoline. So when the tow truck tried to pull it onto the flatbed, it hit a spark because it was the concrete and because the gas was on the floor. It then lit on fire yet again, and then the station, the gas, not the
it was such a stressful story. They wouldn't let her finish.
Caught fire, and then we had to call 911 again. And both times that I called 911, they hung up on me.
They knew it was you.
That I called 911.
What are you gonna do about it? That's
this is going to be an ongoing. This is going to be an ongoing topic, I think, and somehow we'll make it related to healthcare technology probably on the next show.
Well, she didn't die. Look at her; she's healthy.
I know.
You are. That is great. So God bless Melissa. God bless however she lived. If anyone would like to contribute to Melissa's legal fund, you know where to tip us. Just saying. Okay.
Guys.
Oh my gosh. Okay, on to the news show. Okay, so like Leslie had to help me with this because as you guys know, I don't actually get my own news from anywhere. So there are some things in here that I read myself and there are some things that I didn't read myself. So Leslie, tell our loyal followers where you were this week. You went somewhere.
So I was in DC for the Cancer Research Data Exchange Summit. So, and that was very fun. Yeah, it's like, listen guys, it was such a beautiful collection of like 200, 250, whatever it is, invited data scientists, but then also you have like clinicians, and then you also have advocates. And then me, I think that was confusing. It was fascinating. And then, it was almost like shooting a BB gun into the ocean, honestly, because it was like, hey, how do we help solve cancer data exchange? And, and they broke us into these small groups and, made sure that everyone, who was applicable to those categories was in each of these groups. And then they were like, okay, now talk. It was so broad and so big. And one of the guys in my small group on Wednesday said, hey, do you think we could maybe like narrow this down a little bit? And the representative was like, no, I challenge you to keep it broad. So it was just like, I don't know. It was very fun to see like those different personalities in all one spot talking and trying to solve a problem. It was very interesting. So I appreciate the powers that be. Yeah, it was, and then there was like, there were the nerdiest jokes that I've ever heard, I think, in my entire life. And then also, but it was great. It felt productive. I think they were really happy with it. Obviously, Cancer X was the co-sponsor for it. So, and it was at the National Cancer Institute up in Rockville. So it was cool. It was a good time. And then,
we love Cancer X.
Yeah, and the most important part of it, as we all know, was that I had dinner with President Joe Mercado, and he got me cupcakes.
President
so
Joe
obviously,
Mercado.
so that's the
Love
most
that
important
guy.
part. Yeah,
Love that guy. He's
yeah.
amazing.
How about you? You were at
Okay,
ATA.
well,
Tell us about ATA.
I went to the ATA. So we have two guests who are going to actually tell Leslie, as you know, when I go to conferences, I don't actually go to the conference. So I have no idea what actually happened, but I had a lot of great meetings. I also did not actually attend NCPDP, but I was there. So we don't have anyone to tell us about NCPDP. We'll probably get, maybe Pooja can come on and tell us about it next time. But both Raihan and Gloria are going to tell us what actually happened at the ATA. So I'm looking forward to that. But I did go to several parties. So anyway,
Obviously.
okay. Now, now we're on the news show. Okay. All right. So again, this is just random shit that I found on the internet. So, well, there was a lot of talk on Health Tech Nerds about this. So Steward Health filed for bankruptcy. This was like a little expansion recently, and now there's like not an expansion. And so there's been, we've talked about this internally at Incena, right? Like a lot of hospitals are just like broke, like super broke. So this continues to be a broke thing, which, is not super great for a lot of digital health companies that are trying to make money off hospitals.
Right. And I didn't dig super into this one, but obviously we've all been watching them implode over the last few weeks or whatever since they announced it. And it's one of those things, like employees are coming across and saying that they haven't been paid. But
what?
I think more. Yeah, what? Yeah, and then of course they're pointing fingers at Bank of America, like it's their fault that they went bankrupt. But more importantly, it's like interesting because to your point, I think a lot of hospitals and health systems are broke and they just haven't shown their underbelly yet. And so I think that's why this is such a significant one, is because who else out there might be on the brink?
I don't know, but we have a special guest who's going to talk about if this was a prediction. I don't know what's going to happen.
All right,
oh my God.
Cool.
Okay, I put this one because you guys, Leslie baited me. Everybody knows I am not a big fan of these GLP-1s. I'm probably the only person in America who's like, no, mostly because I don't like how they're marketing them. Like it's totally the OxyContin playbook, and it just makes me want to throw up. But Leslie, I did actually read this. Okay, I'm glad people are having babies. That's fucking great. I don't know.
I mean, so anyone who doesn't know this is essentially obviously overweight can cause fertility issues. So a weird thing that they weren't really thinking about, according to this article, is that women are losing weight not on birth control because they've been trying for a really long time and getting pregnant because they're losing 20% of their body weight. And so, and then obviously the light bulb came on of, we didn't do any research on what this could possibly impact babies. Kind of like how they tell you to get off of birth control for several months before you really start trying. The same thing. It's these are hormone-based drugs. So that was really, I don't know. I think you can still legitimately hate them for at least a little while longer.
I'm going to keep hating them because I'm going to be right. I'm going to be right. If I hate them long enough, I'm going to be right. Also in here, it said that, there's apparently a warning that says OxyContin, or not OxyContin, Jesus Christ. I'm thinking about ideas. But apparently these GLP-1s can actually affect birth control, actually interfere with it. So anyway, watch out, people. You might get pregnant, have an Ozempic baby, unsure. Oh yeah, this one was yours too. Listen, if
this
I was a medical
interesting.
student, I wouldn't go to a red state. I'd be like, that sounds dumb.
Well, and it's so interesting. So they did this study, the Association of American Medical Colleges did the study, and for the second year in a row, aka from 2022 when they overturned Roe versus Wade, they've noticed that as medical students are graduating, they are not applying to the 14 states that have bans on abortion. And it was interesting. It's interesting, I guess, from just that, but also when you were digging into it, when I was digging into it, they were talking about how it's also because, they're in their 20s and they actually want to go do residency in a place where they can put down roots and, evidence-based medicine, hello. And it wasn't just OBGYNs and ER, right? It's everybody, it's every specialty. It wasn't just specific. So I don't know. And so they were talking about how this could impact how this is such a bigger thing than just that. And not that everyone on this call doesn't know that, but it's such a bigger thing. It could really affect, especially with staffing shortages, healthcare communities, entire communities can be impacted by this. So,
and this is Leslie and I beaming in from a red state. God bless. No big deal. Oh yeah, this I really like. So you said they were talking about this at the cancer thing up in DC, right? Where basically it said 50% of the messages that were sent from this stuff were good, but then 7% caused serious harm.
Yeah, well, no, yeah. They weren't talking about that. They weren't talking about it at the summit, but it made me think of the summit. So this one is, Mass Gen did a study, and they did 100 questions, and they compared the ChatGPT's answers to actual oncologists, because it was cancer related. And 58% or something like that were like, fine, like we could totally just send this. 88% or something around there was, we want to edit it, but it was helpful, and it helped us with burnout because it kind of like helped, get to part way there, which is really what ChatGPT is for. But yeah, 7% was like, this is critically bad and could really harm, and really, really, so, shocker, everyone, AI needs oversight still. It was one of those things. But at the summit, they were talking, that was a big thing because AI kept coming up, obviously. And they were talking about how it's such a big burden. It's a big burden on physicians if they start using it for decision support, because we don't know the quality of the data. We don't know what systems they're coming from. And that puts so much more burden on the providers to fill in the gaps and hope for the best. So I just thought that was a very relative to.
Well, I'm hoping some of our special guests fight with us about why I think AI is dumb. I'm like,
yes,
because which assholes are writing content that the AI is eating and making stuff up. You and me, like Leslie, you and I are like writing a bunch of bullshit on the internet, and the AI machines are like munching that up, and then they're like, and it's like, it's just start freaking. It's the Health Tech Talk Show, like that's just feeding. We are so screwed. Oh, we are freaking. Anyway, okay, all right, we got it. Yeah. This is like great, right? I mean, sort of. Like, I don't know. I guess like God bless Alabama.
Wild.
We love our red state neighbors. Leslie and I, we make fun of Alabama a lot because, like, who else can we make fun of, right?
Our first, you remember this, Kat? Our first road trip together was to Alabama. I don't know. I thought of that earlier. I don't know if you remember that.
It was Huntsville, Alabama. I do remember that. I remember stopping to pee in that weird gas station where they were selling the worms for the fishing bait, and that was like their business model. Anyway, you guys, Alabama is leading the way in a thing, not just space. And whatever else, and being worse than Georgia, but they have a really strong push for the Gardasil, the HPV vaccine. So, and they're like doing a good job, like actually getting stuff done and going out to rural communities and advocating and letting them know, like, guess what? Like, you're not going to grow 7 heads if you get this vaccine. So that's really cool. That's great.
That's super cool.
God bless Alabama. Oh, what did I miss here? Oh, I really don't think this is news, but again, this is something maybe our special guest can talk to us about. Like, because I have Matthew Holt's Slack up here from Health Tech Nerds, and he was like, "Oh, Health Tech is back," and I was like, "Yeah, I mean, this
just Glenn Tolman."
Yeah, I don't know. Like, it's Glenn Tolman, and then it's an inside raise, and like, I mean, I just like I don't even freaking care. Like, whatever. Okay. Oh yeah, this is just like got more God Bless America type stuff. Like, I'm surprised this also isn't coming directly from a red state, but like, yeah, it's like you got to pay for your surgery up front here. Like,
but the whole point of this is like a first one. Like, they're going out of business, so now
what I want to know is, like, do you get a refund if they screw it up? I don't know.
Oh, that's a fantastic.
I don't know. Okay, so this article was from Leith States, who's like the CMO of OASH. So I actually was planning on having more time today than I did, and it said you should read the full article instead of just the headline, and I didn't. So I actually don't know if we should talk about this one, because I don't know if it actually says Narcan was bad. I don't know. So now I'm like confused. I didn't read it. I don't know.
This is very funny.
Like, I'm excited.
This is the only one I didn't read out of the ones that you sent me. So I think we should move on.
Okay. We're going to skip it. We're going to talk next week. I do. Oh, yeah. Okay. So this is kind of, there's a little bit of opioid trend here. Everybody knows I am like, we are going to crush the opioid epidemic. God bless America. But anyway, so Zoria Foundation, we had a big fundraiser this week. This is like good, happy, feel good news. So many of you all donated to our foundation. Leslie, unofficial board member. According to the IRS, we are the same person. So, she can't be an official board member because, we're like legally bound entities here. But unofficial board member Leslie Kirk really helped us crush this. We raised 5 full-year grants for moms with healthcare for childcare, which is totally rad. It's our first time doing full year grants. We usually just do
So cool.
1 month, $1,000. So rad. God bless Carrie Newlish, who accidentally wired enough for 2 grants. Whoops. How did that happen? We don't know. That guy's freaking great. And then Sonia Chambers donated enough to close our last gap on the last day. And so related to opioids, Sonia lives in Huntington, West Virginia. She's in charge of the West Virginia Health Information Network. And she's introduced us to a number of, to Marshall University and their programs in the city and the surrounding areas that are doing awesome work for people affected by opioid use disorder. And this is, Insena actually sponsors an apartment at Project Hope for Women and Children. And this is Sonia showing off our sign. We're going there in a few weeks to see it ourselves, but she let us know what was going on. So it was like a whole opioid thing going on here. We didn't even know. All
and
right,
Lisa,
other things.
Lisa's 2000. Lisa's 2000. Just calling that one out.
Right.
Yeah.
So many people gave us so much money, right? But like, but Lisa gave us a $2,000 head start, for which we are very grateful. And Lisa I'm so excited for her to see all her LinkedIn notifications when she gets back from this wellness retreat that she's on. Okay, other things. Speaking next week, we're going to Europe. Leslie's going to be our film crew, probably. I don't know. Did we figure that out yet?
We haven't talked about it.
All right.
Day before, maybe. Before.
Now okay, we're going to move on to our first guest, which I might have in order. Hold on. Here he is. Okay, so Raihan, do I say your name right? Because like Nadine told me I don't. Raihan?
So I'm so proud of you. You finally got my name right. It just took the second show. No, I'm kidding.
I'm so sorry. Listen, I'm really sorry. But I said it right.
You did.
Okay. All right. Are you okay? Anyway.
Good
all
name,
right.
Good
so
name.
Raihan is good name. Repeat guest. This is the second time. So you guys, so he showed up in January to tell us all of his predictions. And then like maybe a couple months ago, I got a Slack and you were like, OMG, it's all coming true. And then I think you canceled several appearances. And then you went to the ATA, which as you know, I didn't actually really attend. So here you are. Like, what are you going to tell us?
I'm
like, what
so excited.
Leslie, he says he has Spicy Spice and the hot goss and like all the tea. That's what he told me is happening.
That's good because I haven't heard any of the gossip yet from ATA. I'm so excited.
Oh my God.
I mean, that's my brand. So, you know I'm going to come with fire. So I have my predictions article up. I'm going to just name a couple of them.
Yes.
And then we'll see how we did, right? So we'll start off with, this was number 7. Another health tech bankruptcy or scandal will unfortunately emerge. Now, I said health tech, could have said healthcare, a little different, but with Steward, with change, with Ascension happening right now.
Oh yeah.
It's not looking too good. And, by the way, and again, my commentary was really, what happened with Babylon and companies of that nature. But there will be more. There will be more. There are a variety of late stage companies that are like, wow, we're in tech-enabled services, and what we're doing doesn't really work. The clinical validation is not there, or the AI is not real. And it's just really a bunch of automations and, non-AI algorithms. So as we know, founders will pitch a hope and a dream, but the journalists are coming after you. And look, when funding is drying up a little bit, people are looking for stories, and people also want accountability, right? So I think things are going to get a little bit worse the next couple of months.
So, okay, wait, not to be the asshole here, but like just to challenge that a little bit.
Yeah.
It's just the prediction was that something bad is going to happen. So that was a pretty loose prediction. I was just going to say, like, name a year where that doesn't happen. So
I'm still into it. I just
want to throw that out there. But listen, I'm glad that you were right. I love when people are right, so it's fine.
Right. So the next one was way more specific. So I said,
good. Okay, let's go that way. Let's do that one.
So I said fundraising boom in Medicaid, senior care, women's health, and I said infrastructure 2.0. So I'll start with the last one. So infrastructure 2.0. So a part of this was looking at fintech and health tech, right? So kind of modernizing the financial rails of healthcare. So medical coding, billing, payments, RCM, claims adjustment, price transparency. And I will say there were quite a couple of deals that happened both early and late stage, and I have two examples. We saw Cohere Health, which raised a $50 million Series B extension. They're automating prior auth processes for health plans. Now, regarding where you fall on the spectrum, that could be either good or bad, but that is in that fintech, health tech space. And then very early, there's a company called Handle Health, which I had the pleasure of mentoring for Techstars last year. They raised a very small seed round, $2.5 million, in price transparency, right? Just helping consumers find out what prices are. So, we definitely saw some traction there. When we think about, I had a prediction around BBC infrastructure and specialty care, a company called Aligned Marketplace. They just raised an $8 million seed, a network of value-based primary care providers for self-insured employers, right? So I think we did see a lot of that category. So, for example, women's health, MIDI Health has been on fire. Shout to the CEO, Joanna Strober. They raised a Series B, then they just raised a massive Series C in the menopause space. So it is really cool to see some of those areas.
Yeah.
Putting it out.
That's a good one.
As we all know, we're gonna be fully documenting Lisa's journey into menopause. So I'm excited to just follow along and see how this all works. We'll be documenting my first mammogram. So women's health, we're totally here for it. I'm ready. It's not going to be a problem. But on the infrastructure front too, not all of it needs to be venture capital, right? ARPA-H just did their big women's sprint for women's health. Well, I guess it's not over yet. I think applications have closed, but they're going to be handing out a base. I think they're just handing out money. They're just going to shoot it out of a t-shirt gun. I don't know. And then the feds are also doing the big. They've been talking about it a lot. The ONC SAMHSA collaboration on behavioral health IT and getting some infrastructure set up with behavioral health providers, which is totally rad. So, I guess that prediction is kind of right. I have tunnel vision on the Medicaid stuff though, because that's mostly what we do. So I'm always I feel like everybody does Medicaid, but no one kind of does. So yeah, I don't know. All right, what else? What else is what's going on? Oh my God.
Yeah, so happy to.
Did you have good wine at ATA? What happened there?
I was there. ATA.
ATA.
I didn't see you at the party.
I want at least one juicy story.
Yes. Okay. So
tell us the dirty dirt.
So number one, policy and regulatory predictions. So we all know a lot of the telehealth stuff is coming to an end by end of the year. I attended quite a few panels with DC lawyers, and no one would exactly say, because they can't, what they think, but I think what we will see coming down the pike is a 2-year telehealth extension, not permanent, and a 5-year extension of hospital at home. And what folks are pretty certain about is that we will not see permanent legislation in this session. I would look at, so folks are saying watch two committees very, very closely. Watch the House Ways and Means Committee, and then watch the Energy and Commerce Subcommittee. So that was all right, kind of spicy. DEA, right? Potentially a special registry for tele-behavioral health startups as we think about prescribing controlled substances.
Interesting.
Very interesting. They kind of get their own category. Now, are they going to be able to get that, up and running, get public comments, get that passed? Probably not. There's, I think, 8 weeks of legislating left before legislators go on break. So it's a very tight window. I would also look at the lame duck session. I'm that's interesting. Some stuff may not happen. We're in an election year, but maybe December we see some stuff passed. Obviously, there's broad bipartisan support, but that means nothing when the agencies don't speak together. So this actually blew my mind. I had a bunch of lawyers who were like, you think FDA, ONC, HHS, Schumer's office, and all the subcommittees speak together? And I'm I hope. They're no. And I'm wait, what? So just collaboration and coordination amongst all these various layers actually doesn't happen as often as we think. So that, to me, was a little shocking.
Yeah, I think I've known that for a few years, that no one Like they actually don't communicate. But yeah, it's pretty wild. But so Leslie actually sent me some stuff that I forgot to put in the news show about some of the telehealth legislation getting it extended. So you don't, nothing permanent. Like, what's the outlook? Like, is the permanent stuff ever going to happen, or are they still going to be like, God bless the states? Like, just
so I think for a lot of folks, so ATA is like, look, you got to advocate. Cost is the big issue. So the CBO, and I urge everybody to go read, they've scored permanent extension of telehealth, hospital at home, et cetera, for various populations. And it costs a lot of money. Duh. But the idea is that, look, are we trying to get ahead of very expensive utilization downstream with upfront telehealth? Probably. But that's what we're going to have to, fight. And especially, and I know VBC is a different category. There was another awesome person that I recommend folks listen to. Her name is Sanjula Jain. She's at Trilliant Health. And, she writes these incredible reports in value-based care. And she's like, guys, like math matters. And just, CMMI has come out with a bunch of models in the last decade, right? In every category, from nephrology to oncology to dementia, the GUIDE program, for example. They've scored this stuff. And in the last decade, they've seen CMMI has lost $7 billion. And there's a lot of appetite on Capitol Hill of like, I don't know about this stuff moving forward, right? So, I think for health tech folks who are building in a lot of these areas, the money doesn't flow forever. And at a certain point, there will have to be, some real savings and some real cost reduction for this stuff.
Accountability? What?
Yeah.
Yeah. What?
Not
oh
my,
my God.
not my country.
Yeah. That's Okay. Well, Leslie and I don't believe in math because, we do PR sometimes. So, whatever. But okay. So I was at the parties, whatever. I think the Foley one was really fancy. I was there, and I was drinking their fancy wine, and someone came up to me who Gloria's going to have to remind me of the name because I don't remember when she comes on next. But the first thing they said to me, because Gloria introduced me as host of the Health Tech Talk Show, not my real job. And she said, well, telehealth's not dead. And I was like, typically when someone comes at me with a statement like that, all it makes me think is that you are dead. So what do you think about that? Yeah. I'm just like, well, what am I missing here? What's happening?
Telehealth is definitely not dead. So we have to get very granular here. Telehealth is a tool, just like the internet is a tool, right? And some parts of the internet kind of suck.
Love the internet.
And
we're still waiting to see if that's a fad. So that's cool. Yeah.
So look, I think zero cost, low cost virtual urgent care, that's kind of hard. And that's what Optum was doing, right? That is very difficult, right? When you have an experience where you have a different provider every time for a sniffle or a bellyache, also not a great experience. So I think that is struggling and that might be dead. What's definitely not dead is virtual specialty care. I attended several panels with wonderful clinicians at health systems who have spun up incredible access in oncology, palliative care, nephrology, neurology for a variety of clinical conditions, right? And they're billing these incredible codes, and so I think there's a lot of movement in the specialty space. And look, telehealth is a modality, right? I think we need to really further the conversation of a care model. How do we enable, does telehealth make sense in that care model? Is this a care model where it's look, a video visit and then an in-person visit, hybrid care, right? We have to get really, really, I'm a clinician, as you know, and, certain conditions, certain models, it may not make sense, or it might make less sense, or in other models, it may make more sense, right? And obviously there's asynchronous care and synchronous care. So, for me, those types of statements are actually not very helpful. I think what's more helpful is us really getting to, again, did this modality increase experience? Did we see NPS and CSAT score go up? Did we see clinical outcomes achieved, right? From some kind of clinical metric, right? And then of course financial, right? Is this decreasing total cost of care, right? So on and so forth. So I think I'd love to see ATA next year have more panels about that, right? Kind of getting into care models and what the journey for patients in very specific conditions looks like.
Did they talk about licensing at all? I feel like I work with a couple specific use case and specific verticals, and then specialties, and then, obviously bigger national ones. And that seems to be like one of the biggest things, is getting the licensing for the specialists in the right states. And then how do we like match those with the right patients, to your point, especially when we're talking about hybrid care, like that opens up a whole new can of problems. So did they talk about that at all?
They did not, but there's like 4 big frauds in healthcare, and one of them is the state licensing board. I'm like, why? I mean, we have so many anachronistic things in healthcare, like PBMs, but like, why do they exist? Are they actually value add, or just milking money from docs and nurses, right? So I think that was actually an area of conversation amongst.
Interesting. Okay, that's a cool one.
Well,
okay.
Well, it looks like friend of the show, Chris Falama from who's I think Clay's his boss. And Mostly I always get them confused. Mostly Medicaid. He says a lot of companies who thought they would make bucket loads of money on telehealth are dead, but agree that specialty care holds promise. Clay says he is no one's boss, so it's good to know all these things are true. That's great. And speaking of PBMs, for the meetings and non-conference that I went to for NCPDP, one of the people I was meeting with, who I cannot name because it was apparently a top secret conversation, he was like, PBMs are actually in charge of everything. So we'll see about that. Okay, one more piece of hot goss, or something to leave our viewers with.
Something to leave. So obviously, ambient documentation is on fire. They've raised hundreds of millions of dollars. Companies like Ambience and Nabla and Abridge. I'm walking the floors of ATA, talking to some of the exhibitors, and there's a bunch of ambient documentation companies I've never heard of, right? And my favorite question to ask is, how many customers do you have? So take a wild guess. I'm talking to this very small vendor I've never heard of. How many customers do you have? Throw a number out there.
12,000.
20,000 customers. And I'm like, what? Individuals? They're like, no, we have health systems. We have hospitals.
Holy shit.
We have providers. We have like clinics, and we have individual providers. I'm like, how have I never heard of you? So, I talked about, AI adoption in my article. We're clearly seeing adoption of ambient documentation, but not for the reason that you think, right? Speaking to a couple of CFOs and CMIOs, it's still the war on talent, right? And the big reason that folks are now wanting to work for some of these entities is like, look, this just helps with recruitment and retention of my providers, right? That's really the number one thing. It's not, sexy AI. It's like, no, these guys have it. Why don't you guys have it? So that's a very interesting read. Yeah, I think FOMO, to be quite frank. And it's just a way for you, if this can help you like decrease time to fill of your open nursing slots, I'm going to go get this. Is it actually going to make me money in the long run? I don't know. So that was actually very intriguing to learn that.
That's interesting. Yeah.
Good report. Okay. All right. We're going to let you go off. And thank you. We know that because this talk show is a $0 operation, that we actually scheduled you when you couldn't be here. So thank you. You're the best. God bless America. All right. All right. Now maybe we're going to get like oh my gosh, we have Gloria Vanderham here. So Gloria was also at the ATA and also allegedly did go to session. So what was what Raihan said, like, was it actually even true?
Yes, absolutely. Well, and it's funny because you talked about things that are on fire. It's Nurses Week. So you're celebrating nurses. Went to the virtual nursing session, and the woman you spoke with was Ann Maud Johnson, the president of the ATA.
She was great.
She was on her key message and made sure that you knew and it's not dead. I mean, really there were some key themes that I would add on, and we talked about them a little bit, but I know this is great. ROI. So how can we start talking that way, and how is everyone talking in that way as we talk about virtual care? So that was a key theme in one of the sessions. The second was overall the care team, right? Before it was, in hospital setting, bedside, and then there was virtual, and how do those two work together? And all about taking away the titles and more about what the patient needs, right? And where the nurses can fill different roles depending on where they are. But that all comes to trust, right? And trust by the patient. Is that person, that nurse, really a person, or is that just an AI bot that's telling me what to do? How can I trust it? And then the trust within the different areas of folks that are treating, and how a patient can start trusting and how they can start trusting each other even more. And then, obviously, when you think about overall telehealth and what's happening, it's really, virtual nurses are vital to what we need going forward. And that was also a key message within the session. But I think overall, ATA, from my perspective, had high quality content. You saw a lot of people attending sessions. And a lot of folks continuing.
Not Kat, definitely not Kat.
What?
Kat was listening to us on the side. No.
There was I got a lot of value out of that conference, just not in the way everyone wanted me to.
Well, and I think there were a lot of the right conversations and lots of potential with the people coming. I think, it's the ideal situation is talking about all these topics with the right people and the decision makers from administration in the room, right? So it's not only just the nurses and doctors and others that can help affect the system, but making sure the right folks are there. So I'm excited to see how the attendance is next year at the meeting and who's showing up that can really help make decisions happen.
Has ATA been growing? I actually don't know that. I haven't, because it's not that old, right?
I think from an attendance perspective, I think they're sort of looking at a broader list as it relates to who attends. In the past, individual, what I understand, I wasn't around this space longer term, but in the past, they had more individual doctors, whereas now you're starting to see larger groups coming.
That makes sense.
It's great, and helping from a change perspective. You're starting to get a lot of the players that can talk about the ROI, show it, and then newer players that are really trying to make a difference.
That makes sense.
Yeah. Seems legit. What do you think of these AI nurses?
So I have a concierge doctor, and I love it. I love the fact that we can go on anytime. I love the fact that we can have a conversation. He knows trends across across our great United States of America, not just what's happening by, a local doctor in a local place, which all have a role in my healthcare team, because I use them all. But I think it's great. And I hope that there's further trust, but I also want to see how we're ensuring that what's coming through is the type of advice and patient-centric content that a patient can understand. As we've talked about with AI, I'm a supporter of AI and I think there is some opportunity as we think about spreading education and getting education to places that don't necessarily have it today. But at the same time, it's got to really be understandable. And as I'm, speaking about it, even making sure that the words are enough.
Yeah, so I just want all of our audience to know Gloria is also a PR girl. She's actually important. And that what she just did there was called a block and a bridge, right? So she did not address our question, but bridged our audience in a way that we all felt like she was answering it. So
good job.
Gloria.
Yeah, do some math. Do some math for us.
Virtual nurses are great. There's the answer. They're great.
Yeah, God bless America. I freaking love that. So anyway, okay, so Gloria, so you went to the ATA. It's great. Sounds like it was amazing. I had a great time with you. It was wonderful. What do you do in your real life? What's your real job?
Real life. So two fun things in real life. So one, I run a marketing communications firm in healthcare, and we attract customers and clients that want to create change in the healthcare system. So disruptors in that space. The other side, I am the chair of the Rutgers University Alumni Association, and will be speaking at graduation on Sunday. So today, I know. So today we were practicing and so excited to be able to represent the now more than 600,000 alumni, and also get to meet all of the new alumni that'll be within our family starting on Sunday. So lots of fun things. I mean, it's been a whirlwind, right? We launched Bliss BioHealth, which is my company, it's a little bit over a year. And it's been fantastic getting to talk to companies, we say from atom to access. So biotechs and health tech, all the way through to pharmaceutical companies. So we have a good time, and really, if you're not our client, you should be.
What are you going to talk about at graduation? That was good. There was a call to action. See? Oh man.
Yeah, CTA. OMG. What?
I know this isn't about health tech, but I really want to know if you're going to talk about health tech at your graduation, because that's a big honor, right? To talk during graduation.
So 3 total minutes, and really the part that I play is representing all of the alumni from the organization, which is, yeah. So it's more so like
you're not going to ask them for your business either. You're not going to do that.
You did that. I don't know. It's a good idea. Maybe I should.
Yeah.
I mean, somebody's trying to be successful. Yeah.
No, but it's interesting when you were talking about the article earlier on. I'm going to circle back because you talked about the idea that paying for your service before you have your hospital surgery. And my son the other day, who's 18, went to the doctor by himself, and he had to pay a copay. And he came home and he said, "Mom, you're never going to believe this." I said, "Well, what happened?" He said, they wanted me to pay before I even saw the doctor. And I said, yeah, it's called a copay. So that is my message there is teach your children young about how the system works. He was completely dumbfounded that they would ask for money before he even was able to speak to the doctor. So the idea of having surgeries prepaid in hospitals, I think people will not be successful in getting the surgery. And I hope that they survive until they need it, because getting through the system sometimes is super complicated, as we all know.
I don't know, man. So like, I agree. First of all, your poor son, but mostly I agree with like the idea of that, but also I don't know if if I bring my mom to the doctor's office, I don't know that we're not going to get a check for $10,000 in a month, because they can't, to everyone's point, you can't really feel good that they're telling you how much this thing's going to cost. So one check mark in the plus column of paying for it up front is at least you know what you're doing, at least you know what you owe. But
it's true. And you're finding some more transparency. I mean, we were going to get an MRI, and part of what they said to us is it could cost you this. So
coulda, shoulda, woulda. Coulda, shoulda, woulda.
Yeah, I'll do it. I mean, and the truth is yes, you need the test. It has to get done. And, but you already know going in, they're starting with what the cost could be, which is, of course, mind-blowing.
Yeah.
Yeah. Well, it is super dumb. And like, being an American is hard sometimes. Like, I just went and got like my primary care stuff that's, by the way, like freaking free or supposed to be. Right. And they sent me a bill for all the shit that didn't happen, but it was only like $80. And I was like, what's the cost of my time? And I just paid it.
Wow.
Like, yeah. Cause I was like,
but you're in a different category from most people we're talking about. So,
well, right. But like, what I mean, no, I don't think most people should pay it, but I was like, this is going to take me like 6 hours. And like, I just don't have 6 hours, and I would like this to go away. But like you're saying, Leslie, like your mom's got like real stuff going on. It's not, I'm not saying America should pay for the bill. I'm just saying I chose to do that.
So during this Cancer Research Exchange Summit, they were talking, someone, I forget who it was, apologies, but someone asked the audience, how many times have you looked at your own patient record from a doctor's visit? And there's notes that say, or check boxes that say that they did something during your visit that they didn't actually do. And half of the people raised their hands. And that's so crazy, because it's just because they're getting reimbursed for that. So it's just, I don't know. There's all kinds of.
Well, that's true. I paid the bill. It's definitely in my record as having had certain things done, and like it like didn't happen. Track data.
I don't even know if I've seen it in that way. I mean, I think the three of us actually had the conversation about a business that we would like started that could be a concierge service of understanding not only our insurance, what we could do proactively, what we get proactively, but also being able to take care of some of these things that, while we don't have the time for it, they would be able to easily go in and on the back end be able to make it happen. I don't know if a company like that exists yet. If it does, call me. I'd love to use it.
I don't know, but God bless Jesse Roman, who has power of attorney for both me and Leslie, and often takes care of things like that for us. Yes, fantastic.
Yeah,
that's awesome. That is not the answer. That is okay. This conversation is going off the rails. Okay, so Gloria, you. Leslie, go.
No, I don't know where you want to take this, but I want to go back to the AI nurses, the virtual nurses, because I've never.
She already did the block in the bridge. She already did the block in the bridge,
I'm so
Leslie.
Sorry, I'm taking her back. I just want to understand, like, can you like?
I'm not going to use an AI nurse. Not going to do it. I feel the same way about Ozempic and OxyContin.
I think I wouldn't use it. I would maybe use them as like a supplement, like for a second opinion or something. Like I don't understand how you use. Like, do you just go onto a teledoc and that's just what they give you, or how did you? In what context did you? Don't tell us your medical background, but in what context did you use the nurses?
So I use a concierge doctor. That is
sure.
that is a But
We
from
made fun of a company. Sorry. We made fun of a company that does $9 AI nurses. I forget what it was called. Is it Hippocratic AI or is that a different company? I might be confused. Anyway, we made fun of them
I'm
on one of our
familiar.
shows.
Oh,
Yes.
so you haven't used it. Okay, that's why I was trying to figure out
No.
why
I
everyone
haven't
used
used.
that.
I use a concierge doctor, so it's
Which
a
that's
person,
great.
real
That's
person, real
wonderful.
doctor. But
Yeah.
I use them virtually. Whereas, so from a virtual nurse perspective, I haven't really thought about my true opinion on it. But what I will say is this: I think that it's nice to have access to 5 years of data of what something could be. I don't want it giving me a diagnosis. I don't want it trying to comfort me.
Right.
I don't want.
Trying to comfort you.
I mean, let's be real,
That's
right?
a really good point. No, that's a really good point.
This is all about, it's about the patient, right? And amplifying their voice. And when it comes to any new technology that's coming in, if there's a way in which it can help ease either hearing the diagnosis, in the way in which the data will give you a true, what is the survival rate? How are we going to be able to treat this? There's so many different medicines, those things, the data piece is good, but it can't ever replace the human piece. So I think a human nurse with, the HI with an AI is more what I would be open to.
Okay, that makes
All right.
I just misheard
Amazing.
that earlier. Got it. Cool.
Okay, Gloria, you got to go somewhere, and we got to get our closer on the
yeah.
show, Clay Farris. Anything to leave our loyal audience with before you go off and inspire young adults?
No, this is an excellent talk show. I love it. I love Health Tech Talk Show. Thank you for having
See?
me. This is my
Public
first
relations professional. Hire Gloria for president. Oh my God. Okay. All right. Thank you, Gloria.
Have a great day.
All right. And then we got this guy pouring
There
his
we
wine.
go.
Oh my God.
There we go.
So, which is totally legal on the Health Tech Talk Show, pretty much 24/7. We never
Cheers,
know
man.
what is in the mugs. So,
I
yeah.
just want to say
So,
I get up at
welcome.
2:30 every day, so it's really later to me. So if you see if this is normal.
What time do you go to bed?
Right
on. 8, 9, something like that.
What time? Aren't you in the Central Time Zone?
I am. Yeah.
Huh. All right. Okay.
I have insomnia.
Well,
is that what you call insomnia? Is that the same thing for you?
My problem is not getting to sleep; it's staying asleep. But
Mine is
it's gone on for so long, so I've just started to use it in
You just gave up?
my favor. Yeah, I gave up. I tried everything, and now it's amazing what you can get done when you're up like 4 hours before everyone else. Anyway,
Leslie also has this problem. Yeah.
I do.
Oh my
also
gosh,
have this
Clay,
problem.
welcome to the internet. I know that
Thank
you're you're used to the internet because that's kind of how I met you, was on the internet. So and I think like 12 people introduced me to you, including several of our mutual friends who have promoted our show this week: John Hamdorf, Jeff Luz, Tom Novak, probably 75 other people. But you guys, so Clay, I don't actually know what you call yourself because you just said you're no one's boss, but you're like the CEO founder of Mostly Medicaid, which is a consulting firm / awesome content generator / many things, subscription service, conference organizer. I don't even know. Tell us about yourself.
Let's see where to start. I mean, I think the first thing my traditional intro is I eat, sleep, and breathe Medicaid, so you don't have to unless you want to, in which case I'm here to help you. And I've been doing that for about 20 years. It all started as a silly newsletter, and it turned into this crazy thing. And it's amazing how far you can go when you're willing to say the things that other people are not. And when you have the
Well,
freedom
welcome to the
to
Health
do
Tech
that.
Talk
Yeah,
Show.
I was like, that's a good motto that we all live by.
Oh, I've been writing a list of 10 controversial things I want to say on your show. If you
Oh,
want.
I'm ready. Oh my God. Please keep
But to
going.
answer your question, I mean, I think I've had the good fortune to be placed in a lot of positions. I mean, I've gotten to know personally lots of governors and CMS administrators and lots of CEOs from health, all that kind of stuff. And that's just how my life has turned out. But I think I've also been surrounded by really, really smart people who let me sit there and ask them questions all the time. And that's how I learned everything I know, is I just ask people, well, what do you think about this? And what do you think about this? And I think another thing that has helped is being willing to let other people just say what they want to say. Right? We live in this, particularly in healthcare, particularly in Medicaid, as you know, we live in this place in which there is an official dialectic, whether or not we want to acknowledge it, and we may or may not be on the same side as that dialectic. So it's really important to find a place to navigate that. So anyway, that doesn't really answer your question at all. I'm a dude. that loves Medicaid has tried to escape it. I try to use humor and candor to push what I think is my agenda in this space.
You have great
Well,
shirts.
I'm a huge fan. Also, will you bring back Five Bullet Fridays?
Thank you for asking. I will. I'll tell you a little bit about that too. So it's been several months. I am bringing it back. I've been working on it. I've been doing a lot of thinking
I don't know what this is.
about.
Wait, you gotta tell us what this is
Oh,
for those that don't
Leslie,
know.
really the only reason I sounded smart for the past several years, and he hasn't done one since like 2023. So,
It's
Oh.
yeah.
December, and there's a story there. I'll talk about that story one day. I mean, the summary of the story is um, I had a big thing happen that surprised me on a project in which it really threw me for a loop. Made me do some soul searching about what I really want to do. I mean, I've been doing this 20 years, and what do I want to do next? And Five Bullet Fridays is a part of it. There's some other things that I'm going to be focused on and trying to get that out. But yes, it is coming back. I've been waiting until I can get it fully prepped. I've been trying to also build a support team that helps me pull together a lot of that stuff. Five Bullet Fridays is coming back. I'm writing season 1 of the Medicaid Cat Show, of which Cat you've already agreed
Oh.
to be a guest.
All right, I'm
That's going
coming.
to be.
I'm going to do it.
I'll tell you about that real quick, Cat. I don't know if you watched the prototypes or not, but Leslie, I
I
made
haven't
these
watched them yet. No.
prototypes.
No, I don't know.
Okay,
I'm new to this.
they're
Share it.
so
Tell
good.
me.
So I wrote. I mean, so COVID hit, right, and everybody, including myself, was like, "What the fuck do I do now?" Right, and so I'm like, "I don't know. I'm gonna make a show using Snapchat filters and have all these little kittens and other cats reviewing the value props of vendor solutions in the Medicaid space. Like all the craziest thing I could come up with, you know?
Stop it. And
Oh,
you're
it's
gonna do
great.
it? You're gonna do it
I've
for
already
real?
done three. I've already done three prototype episodes. They're
I'm
pretty
ready.
fun. One of them is a solution in which the vendor solution uses telekinesis to change the HbA1c values in the Medicaid members' blood. and they're trying to sell, and they're trying to
Shut up.
sell it. They're trying to
At the
sell it to
front
health
door.
plans. Anyway, there's all
Stop.
kinds of. Five Bullet Fridays is coming back. Producer Billy Bob is going to have an even bigger role. The cats
Producer
are coming.
Billy Bob.
Uh,
I can't.
Cat with a K, not with a C, is going to be like a human. Like if you remember, she's going to do a guest episode, like when Carrie
Uh-huh.
Fisher would do the Muppets.
That's
Anyway,
me.
that is coming back. There's been
What
some
filter are
soul
you gonna use
search.
for cat? That's the question.
No, she's going to be
I don't
human.
need I
She's going
don't
to be
need one.
herself.
I don't
She's going to
need
be
one.
herself.
Oh.
She's going to be herself.
Me right
But
here.
it is coming back. It's just been I've really been doing a whole lot of what am I doing next because there's some really important things going on in the space that haven't been going on in a while, and I think this last experience that I had confirmed a lot of that and is helping me refine my fire to say those things that I think need to be said.
That's
I
awesome.
Anyway,
freaking love it.
That's
I
Yeah.
awesome.
basically told you
Well,
nothing in like 7
I
minutes.
I know. I
That's the
actually kind of
theme.
love it. Like yeah. I just feel like where everybody's real good here. You got your wine. Okay. What are the like? Okay. I don't know if we'll get through all 10 of your controversial things that you want to say, but like, give us
All right.
like just start going. Like, just start at the top.
Well, first I was misled about this show.
Uh oh.
Oh,
This was like the
Uh
health tech talk show. It is clearly the health tech babe show. So thanks for letting me hang out.
oh. God.
hey, no worries. I know. Well, I will
Related to
say.
that, I apologize to all the people I'm going to offend here soon. Go ahead.
Oh no, I think everybody's ready for it. I think
Or
that's
it's only
like part of our
successful if
that's our
everyone's mad
brand.
at the end. It's only
I think
successful.
my first one, and
Yeah,
some of these I hope are like so obvious, right? The first one is realize how much the people on this call and everybody in our world we're completely out of touch with what most Americans experience in the healthcare system. Not to pick on Gloria at all, but most people don't have a concierge or whatever, right? And that prefaces
yeah.
everything that I'm saying in this, and I'm a part of this too. But having firsthand gone through several medical events with friends and family recently, the U.S. healthcare system is completely broken. I promise, like irreparably so. And I think, that's not really a controversial statement, but just that we are insulated from that is super important. Not necessarily related, but here's one. Centene and United are displacing Medicaid community plans. I don't want there to be any confusion about that. If you think community plans matter, I promise they need to start fighting for themselves to exist because they're not gonna if Centene and United have their way.
Yeah.
Uh, P.S. And by the way, the big fives made billions on the public health emergency. The great unwind is a chicken little scam. By my estimate, at least $100 billion went straight to MCOs with very little utilization required for it. That's item 2. Item
Wow.
3, the UHC disaster, please stop calling it the Change Healthcare disaster because you're enabling the
Oh,
monster.
that is an incredible PR move too, right? It's confusing the market. Like,
Oh,
no,
don't
it's
even get me
Change
started.
Healthcare, United. Like, oh man, that's
It,
like, I mean,
it's the
yeah,
9/11 for U.S. healthcare. There are
I saw
a
your post today. I freaking love
there
it.
Ooh.
there is a knowable number of Americans that died because they could not get their prescriptions because fucking United Healthcare did not put in MFA, which I have in my own small business, in something that it bought 2 years ago. Don't let them get away
Yeah,
with
like
it.
I think
Go ahead.
Instena does. Like, and we're like not big.
Right.
Yeah,
That's
For
the
you.
answer, right? Like that's the answer.
We
That's the
have
don't
multi-factor
worry.
authentication. Yeah.
Yeah.
we do.
So
Yeah.
let's
Yeah.
all just make some honor among pundits or whatever. We're going to call it the United Healthcare disaster, not the Change Healthcare. Um, Tech item 1, item 4. Tech is a giant hype circus. I mean, we all know that. The widgets and the cogs run around the JPM Frisco sphere and they get really excited about funding rounds. But it is a
I
graveyard of
run, Clay,
pilots. Go ahead.
I run around there too. Like, I run around there a lot with my wine. So yes, I
I
would
mean,
agree.
I'm not saying don't do it, but let's stop pretending that there's a connection between that and like member outcomes because there's just not,
Mm.
right? There's just not. I mean, I've been doing this for a long, long time. We still have abysmal outcomes for members. Tech is not the solution. It's not. There's a great Sarah Ratner's got a great article out like yesterday about like digital
Sarah
health is not the
Ratner,
solution, and
Yeah.
it's actually causing its
that
own
girl
disease.
is going to save America from the opioid epidemic. Like that girl.
So I mean, there's still plenty of tech bros running around thinking they can. I just heard about this Medicaid thing. I'm going to solve it. You know, let me tell you, it's like Uber but for Medicaid. I mean, that's just. But here's tech item 2. It's all a lie, and but the financial sponsors, i.e., the investors, are starting to catch on. Now we can't talk about that when we're trying to hype it. You know, Slavitt's got to go out and whip it and say, "Oh yeah, here's reasons to invest in Medicaid." We can't talk about that. But the investor clients that we talk to are starting to realize, hey, wait a minute, I need a better read on the market besides what my portfolio company's telling me. You know, and I mean that's starting to happen. No, item 6, telehealth is not our savior. RPM is just for the people that were too late to pick up any telehealth assets. And it's just the latest example of a burning platform that cannot support itself. The market won't pay for it. It needs big government subsidies. Item 7, and this is really important, the final frontier is human to human, right? It's human to human. We're starting to see
Mm.
this in places like substance use disorder, any behavioral health issue. There's just no getting around the need to invest human time in humans, and that doesn't scale. And that's part of that disconnect. Item 8, there's 2 main rhetorical concepts we use to deceive ourselves in this space. Um, One of them is expansion. Medicaid expansion is a giant rhetorical scam. I promise. There's not enough time to go into why that is. The main thing in any state is when is Big Mama Hospital going to say it's okay so that the MCOs can get those sweet, sweet rate sales and not really do much for it, right? And it requires everybody, all the advocates that really believe it and the rural health centers say, we need it to make it work, to make the press release work. But that's just not how it works. The other one is we are all about to start freaking out about work requirements again. And we don't have time to like do whatever on that, but I promise that's going to be a big deal in just a few months because the election. Number 9, the funding and financing in Medicaid is a lie. I'll tell you one thread to pull. Leslie, how you let me know?
I love
Leslie,
it. I love
all right, good.
everything happening right now. I love
Number
absolutely
9,
everything.
Do
funding
you
and
want to be
finance.
our third co-host?
I'll let you think about that. I'll let you think about that. I'd love to, but I'll let you think about that. Sleep on it over the weekend or something. But
Okay, all right, we'll make you an official offer later.
pull
You know,
this. I'm sorry. Go ahead,
For
Claire.
no money.
No, I was just going to make
I'll
a joke
take
about
it.
how we don't have any money. So
I'll pay you. No, take what I pay.
you
Um,
pay me? You
I'll
don't
pay
pay
you
me.
$1. I'll pay you $1.
That's $1
So
more than we have for Melissa's legal fees.
pull
Oh,
this
okay.
thread. Pull this thread. Anybody listening, pull this thread. What is the definition of actuarial soundness? Who defines it? What is there one? And again, I'm more than happy to help you. Like ask the million questions go down that. Number 10, fraud is rampant in Medicaid. Don't let anybody tell you otherwise. Some of it is explicitly legalized. See the financing mechanism. But my estimate used to be 10%. I think it's 20% now. There's other stuff I want to talk about. I think we're probably out of time. I'd love to talk about AI, but I want to point people to an obscure French legal philosopher with the
Oh,
last name of
please do. Oh my gosh.
Bastiat. Bastiat. He's one of my faves. Bastiat. And he has essentially, I guess, a treatise called The Law. And if you do classical education at all, this is one you'll read this like in high school or whatever. To summarize the law, he basically says here's where the law always ends up as one more device by which to plunder for the powerful to use to plunder. And that's where we are. And that's where groups like Centene and United are, and others, not just them. Anyway, that's my
Wow.
Listen.
Wait, okay. I have a question. Um, so I agree with you that our system has a blue screen fatal error, like, right? Like healthcare system, like it's not really working. Um, but like, where do you think we can improve on the margin? Like, where do you think we can? Because I don't think anyone should be like, let's not even work on it. Like this thing needs to be
no.
like blown
It's
Right.
just broken.
overhauled.
Yeah.
Like where do you
Well,
think we can make the most impact?
that full
And
disclosure.
is it through AI nurses?
All right, thank you for giving me the. I don't know what y'all do with the block and the bridge, but I'm gonna take that as a bridge to AI.
Yeah,
But
don't worry. Yeah,
let
don't
me
worry
let
about
me
it.
give you a good answer, and that's where a lot of my soul searching has been coming from. And I've actually been texting with like my high school best friend about this,
Oh my
right?
gosh.
And what I've learned about what I think on this question is I'm still a card carrying member of the Burn It All Down party. I'm as punk rock as they come, always will be to the day I die. And I think, and this is what's hard because it doesn't scale. I really think it's down to the individual to individual. And we try to figure out how we do that in our work. Like we try to, and I'm sure y'all do too, but it's like, okay, this sounds great. Value-based care and ACOs and health-related social need, blah, 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 blah. Okay, at least walk me through conceptually how an actual Medicaid member will benefit from this, like in real life. And so I
Yeah.
guess I'm saying don't be surprised if I just disappear and I go be a counselor or something, right? I don't think that's what I'm going to
Mm,
do. I don't think that's what I'm going to do. But I think it's that individual to individual level. We've got to stop operating off of here's the big
Yeah.
thing I'm going to do to change everything and innovate. That's what I believe. I believe it comes down to these individual relationships, and for me that might be people that I clue into some of this stuff and then they go influence within their sphere. It might be, I haven't done it in a long time, but I used to go sing old hymns in nursing homes, right? Like for
hmm.
old folks that haven't heard that thing in 60 years or whatever. And I'll tell you right now, I made more of an impact in 45 minutes in the local whatever, uh, a lasting impact than I made in some giant fancy project. I love
Oh
my projects.
man.
I love my clients. I'm trying to impact. But to answer your question, Kat, where can we improve? I really believe all of us in this space have to keep doing what we're doing to pay the bills, but we need to individually find places in our lives where we make human to human investment on these things we say we in
That's
the
a good.
boardroom that we say we care about.
Agreed. Well, I'm looking forward to Leslie calling me after the show to talk about our mutual midlife crises that we're having right now because of this conversation. But yeah, totally agree. We talked about this West Virginia thing that we sponsor, Marshall University's Project Hope for Women and Children. So we spent a lot of time working with the WIN there, the West Virginia Health Information
Right.
Network. And one of the reasons I love this group, right, to your point about like technology is not like saving us all, is that group really invests in how they can support the people on the ground with those
Right.
programs. Like this is opioid use disorder, right? This isn't like let's get on an app and talk about our freaking feelings, right? It's like
Right.
real. And like I do think there's they've done a really nice job of enabling more people, more peers, more clinicians on the ground in an area where there just aren't enough people to serve the people in need. But I completely agree with you. A lot of this stuff is bullshit.
It's very, if you take real stock of it and our own part in it, it can be very demoralizing. But I don't want it to stop there. I want us to say, okay, now what do we do? Now that we know this, now that we're honest with ourselves about this, what do we do?
Yeah, well, that's a good message though, because we talk about this all the time, which is that every single time we're presented with a problem, it's not a small, it's a giant problem,
Right.
and then also it's like, how do you scale it even hard, and then how do you innovate on it when it's outdated inevitably in a year and a half? So I like that combination of like how we can all individually contribute something, and then that is actually scalable if everyone does something. Like if
Right.
everyone does a little bit, and
Yeah.
gives up a little bit.
That's a good CTA. Back to
There
good
it
PR
is.
practices. That's a
There
good.
it is.
Everybody do something. Everybody
Big
do
Mac.
something.
Everyone do
Big
something.
Mac. Big Mac.
Are we? Do
Math
we
is
have
not
time?
real.
I love
mean,
that you say that.
we're in charge of our own talk show. So if you want a few more minutes, like all we have to
I'd
do
like
is
to
not.
I'd like to talk about AI just for a moment, if that's okay.
Okay. All right.
And I'm not trying to convince. I hear the anti. I definitely have gone back and listened to some previous shows, and my thought, the themes that I heard were AI and menopause, and I'm very excluded from the latter, so I can't really talk about that one.
Would you like to talk about your prostate?
We can talk about it.
I'd love to.
Equal opportunity.
We have male fans. I'm sure they would be delighted to hear about your experience.
Let's go back to AI. I'll ask AI.
Okay.
So I'll tell you. So I personally have used AI a ton, and what I rapidly wanted to understand is, what is this thing, right? Like, I'm really big on the fundamentals of it, and part of it is I feel like 98% of people really don't understand it at all, and they think the people that just hear whatever fear mongering, whatever the nightly news is these days, oh, it's going to take our jobs, whatever. And it's going to take certain jobs, but um, it's not this magic machine in a box type thing right now. Like, predominantly, particularly the large language learning models, and of course there's other stuff too. Here's the humbling thing: it learns the same way you and I did. We're not as special as we think. What did we do? We read a bunch of stuff, we listened to a bunch of people, and we looked for patterns. And I highly recommend people that want to get into it more read some of the OpenAI like concept papers on like what it's doing in its token, plus and minus, look for stuff or whatever. And there's a whole other story about OpenAI and Microsoft and what it's training on and all this kind of stuff. The real concern about the language, particularly LLMs, is like call centers, that kind of stuff, anything related to member engagement. United's already been busted for stuff related to prior auth, but it's here, whether or not we want it to be here. I mean, I think artists are really struggling. Artists are really struggling with this, and that is a different category, right? Like the style and stuff. But I guess what I want people to hear is take a minute to really, and I'm not talking to y'all, I'm talking about anybody that's listening, do some digging and figure out what you think it really is, and where it is today. Because I promise, whatever is released to the general proletariat like me and you, I promise Microsoft and like Deloitte and PwC, they got the good stuff right now. You know what I mean? Like they got the good stash. And so anyway, that's my thing on AI. I mean, I've used it sitting in ERs saying, hey, this, and this, what should I expect? What tests make sense? What don't? I've used it. I mean, I've got particular thoughts on physicians or whatever. Anyway, I know y'all are talking about it, and you're talking about it in probably in like a technology context more than anything else, but I think it's way bigger than that. I think it craters. Like, if you look at some of the read the Reddits on ChatGPT a lot. If you look at like how people have been able to learn things they were not able to learn from human teachers because human teachers like scolded them and stuff. I mean, the promise is huge, the danger is huge. It's way further along than we think it is. That's my summary.
Well, it's giant, and that's kind of an ongoing theme, I guess, with me. Is like, it's such a big. To your point, it's so much bigger than just point of care solutions or back end exchange, back end data analysis or whatever it is that you're going to do it with. And I think that's the problem, is that people are scared of very specific pieces of it, like the point of care issues. Like, is this doctor, like Gloria said it earlier, I don't want an AI nurse or a doctor telling me my diagnosis. And I think that's what people immediately jump to, the worst case scenario, as opposed to, but I also think it can lead to, this is a total tangent, but lead to also how we're addressing, how we're teaching our physicians and nurses and care teams,
Sure.
because they're going to need to focus more and have more training on, instead of just, being data tanks, actually understanding the value that they can uniquely bring, which is looking and understanding behavior and, trying to figure out like what their social determinants are, and like all of these pieces that AI might not be able to do for a very long time. So
But I come back to large language learning models do it exactly the same way humans do. They just do it at better scale and faster. And I mean, I think one of the more positive things that I think we've seen in the last maybe few generations is the stopping of the worship of the letters M and D,
yeah,
And what I always say is, what they call the guy or the gal that graduated dead last in their medical school?
doctor.
Doctor. Don't forget that 90% of physicians were not in the top 10% of their class. That kind of thing. I mean,
Right.
having done evidence-based medicine work all my life, having essentially been raised by doctors in a certain professional context, having supposedly gone to the best school of public health in the world, blah blah blah, we're not necessarily making the right comparison. Like, there's a lot of really crappy doctors.
Yeah. Well, and that's okay. I'm sure we're running out of time, but that's another thing too that I know is a
You
big
guys have one more minute. You have one more
this
minute.
is a big conversation, is who's liable. And I think, like, we kind of
Right.
talked about this earlier. It's like, would I rather have a mistake done by a human who I'm expecting to sometimes make mistakes, and then I can sue the hospital, or would I rather have my mistake done by an AI bot? You know what I'm saying? Like, there's almost something there too. Is who are we going to be more patient with making mistakes, or who's even liable when someone makes a mistake in that setting, in that context?
When the AI nurses. Boo.
Yeah, when the AI nurses,
It's hot on these AI nurses.
Boo.
virtual candy
I'm like,
canes.
not good. Yeah.
Thank you for having
Okay.
me,
All right.
ladies. Thank you.
Well, thank you for coming. And friend of the show and superhero Michael Marchant says, is he going to post his manifesto? So I'm hoping that you send us your top 10 list, so that we can put it on the internet.
I'll
Please do. Send it over.
Yeah.
You're awesome. Everybody, look for the return of 5 Bullet Fridays. They were the only reason I sounded smart for a few years. So that's why I've been super dumb for the past few months. The Medicaid Cat Show is coming.
It's going to be so good.
And we're going to make Clay an offer to be our third unpaid co-host. So basically it's going to be amazing. You guys the best. Happy weekend. Thank you.